I'm Donal Collins, I'm a GP. I work in the firm in Gosport area and I've been here since 1994. We became involved with the whole idea of MCPs because general practice was in crisis. We had a huge problem in Gosport, particularly around GP recruitment. A lot of GPs were drowning in work. It was very concerning because suddenly the risks of running a business became evident. GPs were looking at handing back contracts, being stuck in leases and buildings that would still have 15 years of rent to pay. And as chair of the local federation, I felt I couldn't stand by and not try and do something to make this better. The vision behind the MCP that really got me excited was about creating a truly integrated system, a system that acted as one for patients. Which room am I in?
Sorting room 3.
Thank you very much.
You're very welcome.
Some of the fears that most GPs in the area, particularly the ones who weren't feeling the heat of recruitment, would be that this might mean a loss of sovereignty, a loss of autonomy, some bigger organisation is going to come and take us over, and then we will be told what to do rather than do what we believe is right for our patients. I can understand why you would have those fears. I personally don't believe it's real, and the only way of demonstrating that is making it happen. So what we've done locally is, for the practices that were under real pressure, we looked at what was the issues and building the extended primary care team. So looking at the work that a GP does and saying, this portion of your work you probably don't need to do. So we shifted some of the urgent care work to this place, which is the same day access service, where people can phone up on the day, say, I'm ill, I need to be seen, and they'll have a consultation over the phone, and then if they need to be seen, they're brought in here. But 60% of patients are actually sorted out on the phone. 40% are seen in here, and of that 40% that come in here, only about 20% of them need to see a GP. Hello, Carrie. Back in the surgery, we've got a controlled workload with longer appointments, so we've longer times to deal with those patients who need complex decisions making. Freeing up the day job creates the time for people to think about, actually, this is an area I enjoy working in, so they will have time to develop themselves, take on further training, do postgraduate diplomas, work closely with hospital colleagues, and bring some of those hospital specialisms out closer to the patients, out in the community, into the GP practices. Molly Murphy. To give a personal example about an interest I have, which is ear, nose and throat, ENT speciality, we've been able to set up a direct access ENT clinic where patients can be booked in without referrals, seen earlier. So again, we can sort out issues much quicker, which hopefully will mean that patients are being referred into hospital less. Can you hear better? Yeah. It really is personally gratifying for me to be able to do the job I was trained to do. The benefits of going down the MCP route for the team is it's going to create an environment where we can improve outcomes for patients. We're going to stop working as individual silos. The last 20 years have proved that that hasn't worked. We've got a new way of working together for our common purpose and mission. One of the concerns that the managers might have is, if we come together, does that mean I'm going to lose my job? But the reality is that hasn't happened, and the benefits are that they've been able to specialise into areas that they're really good at.
Thank you, bye-bye.
I think in our area, we're probably going to be looking at a mixed economy. We have some practices who are happy to be fully in the MCP, employed, and for other practices, that's not right for them. Their partnership is working. So we can see partnerships existing within an MCP. For the practices that have come together, it has taken the risk out of general practice for them. They've taken the risk of the properties away. They now have a secure income, and they can now focus on the job they need to do. Doing nothing is no longer an option. We're going to end up in a much worse state if we don't do something with this. We need to get the system leaders around the area to say, actually, this makes sense. if we invest in this, it will create savings within our organisations, and that's where my hope is. But that will be a challenge, because within our siloed mentality, we only look at our own bottom line, not the system's bottom line.